Support for Consider This is provided by
There's a new place for senior care with daily laundry service. A place with a day spa. A place where seniors get the care they need in the comfort of home. Home Instead Senior Care.
from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
And every so often, the flu morphs from a seasonal nuisance into something far more dangerous, an epidemic, or even a pandemic. That's what happened in 1918 when influenza spread across the United States, Europe, and Asia, infecting 500 million people worldwide and killing some 30 to 50 million. In terms of deadly force, the 1918 flu is rivaled in history only by the infamous Black Death, or bubonic plague, which terrorized the world in the 14th century and caused some 25 million deaths in Europe, about 1/3 of the continent's population at the time. From its relatively mild origins in an army camp in Fort Riley, Kansas in March 1918, the flu traveled to Europe with American soldiers headed to World War I. By May, it had reportedly caused some 8 million deaths in Spain alone, earning it the name Spanish flu. No effective flu vaccine or treatment existed at the time.
My, how things have changed. Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, the flu season, what you need to know this year. Here to talk more about it are Dr. Allison Freifeld, an infectious disease specialist with UNMC, and Stacy Hanna. Stacy is the Director of Sales and Marketing for Sunrise Senior Living. Here today, speaking from her perspective as a licensed nurse. Thank you both so much for being here and welcome.
Thank you for having us.
You bet. Dr. Freifeld, we're going to start with you. Let's pick up where that video left off. Milestones that brought us from no effective vaccine to where we are today.
That's a great question because the 1918 flu was devastating, and since that time we've actually had 4 pandemics, believe it or not. But so much has changed with regard to, first of all, the invention of the influenza vaccine, and that was in the 1940s. Dr. Salk, actually, who did the polio vaccine, also was a person who developed the initial flu vaccine, and it was used in World War II in soldiers going abroad, and it had a great effect in reducing influenza illness. Since that time, there have been tremendous developments in various types of vaccines that are more potent, more effective, but the influenza virus is a very tricky virus. It tends to mutate or change from year to year, and so the challenge for the World Health Organization, the CDC, is to keep up with this virus and figure out what's coming for the next season. And so each year, a new flu vaccine has to be configured to try to match what they think will occur that next season. Additionally, we've had the development of antiviral drugs that are effective against influenza. And these have just come about in the last several decades, but several of them are very efficient and effective if started very early after the course of flu begins. So you have to really take these drugs after the initiation of symptoms and a diagnosis within 48 to 72 hours at most. And so many people don't recognize that they have the flu, so there's a delay in that. But with these two developments, I think we've really been able to harness the flu better, but it's still a potentially deadly disease.
Okay, thank you. And Stacy, that's a really good segue when we talk about signs and symptoms. So important for people to know and be able to recognize. We have a couple of graphics that we're going to put up for our viewers, and if you could just walk us through signs and symptoms of the flu, first in children.
Sure. So in children, things that you're going to notice with the flu, they may have more rapid or fast troubled breathing, difficulty breathing, a bluish color in the skin because they're not getting enough oxygen. You may notice more severe irritability, a fever or a rash. They may not want to interact, not taking fluids or their bottles. and symptoms that don't improve.
Okay, and in adults then?
In adults, you're going to see, again, difficulty breathing, pain or pressure in the chest or abdomen. You may see some dizziness or confusion. Sometimes and sometimes not, vomiting and or diarrhea. In addition to these symptoms, some things that you might notice would be headache, fever, chills, body aches, cough, stuffy runny nose. The symptoms are very much like those of the common cold. The difference is with the flu, the symptoms are going to be more abrupt. So it's going to come on more abruptly, whereas the common cold, kind of progressively, you're getting the symptoms. Another difference with the flu versus the common cold is with the cold, you very rarely will have a fever with that, the body aches, the tiredness. So those are kind of the things that set it apart.
Yeah, and I think that's really, really important to note because you can get easily confused, and obviously if we aren't able to recognize things properly, we're not treating things properly. Dr. Freifeld, anything you want to add to that?
I totally agree with what's been said and want to emphasize that a high fever is an important sign, as are body aches. People feel like they've been run over by a truck. I've heard that many times. Just unable to get up out of bed. Often a dry cough, whereas with a cold you may have phlegm produced. Not typical with the flu. So the other thing I would add is that the flu is typically also very protracted. It can last days, up to a week or more. And so it's something that continues on with fever day after day. You feel like it's not going to end. It's just a miserable disease.
Yeah, and the other thing I'm thinking about as the two of you are talking is sometimes when we're not feeling well, it's really difficult for us to articulate properly what's going on. And I'm thinking specifically about children and older adults. And so the advice there, when in doubt?
Oh, absolutely test during the flu season. It's really important, particularly as you said, in those extremes of life. Very young children and the elderly are the people who are at greatest risk for complications from the flu. And those would include pneumonia, bacterial infections of the blood or the lungs, worsening of diabetes or heart disease. So it's really something that goes beyond just this viral illness. It has many complications that are potential.
Well, let's talk about the window, Dr. Freifeld. What are we talking when we talk the start of flu season and the end of flu season?
Well, typically it starts depending on what hemisphere you're in, because I want to emphasize that this is a very contagious viral respiratory illness that affects people worldwide. And the season is the winter season in both hemispheres, which of course are in the sort of May to September range for the southern hemisphere, and from October to March, April in the northern hemisphere. And so the flu circulates, flu viruses, I mean to include multiple viruses in this, A and B and different subtypes, are circulating all the time around the globe. But the peak illness seasons are the winter months, typically.
And what's the latest with this particular flu season? What's in the news right now?
Well, right now we have low flu activity throughout the United States. We're starting to see, inklings of the flu occurring in various states. We just finished flu season in the southern hemisphere, keeping in mind that the flu that circulated in those regions are the viruses that are being used to, or have been used to produce the current vaccine. So that's how we try to keep up with it. The CDC does an excellent job of tracking influenza, and if you go to their website, there's a whole section called Flu Tracker, so you can see how much flu is occurring case by case, state by state.
Wow.
So it's something very important to keep an eye on.
Well, let's talk specifically about this year's vaccines. We have another graphic for our viewers that we want to put up, and if you ladies would kind of walk us through, some of these are words that I don't recognize, so
Sure.
help us out here.
I don't know if you want to go ahead and read through, but what we'll do is note that there are 6 categories of vaccine. There are multiple manufacturers for these, so more than 6 vaccines on the market. The first 5 that you see, trivalent vaccine, quadrivalent vaccine, high dose, adjuvanted, and recombinant, are not live. That means you cannot get the flu illness from the vaccine. It's impossible. There is no live flu involved in the production of these vaccines. Well, there is in the production, but the ultimate influenza that's given is killed. So the trivalent and quadrivalent vaccines are your routine vaccines that you might get in your doctor's office or in a local pharmacy, for example. The difference between those two is that the trivalent covers 2 types of influenza A and 1 of influenza B. The quadrivalent covers 2 of A and 2 of B, strain-wise. There's not really any recommendation for one over the other, so either of those are perfectly fine. The high-dose vaccine and the adjuvanted vaccine are kind of boosted vaccines that are indicated for people 65 years and over. And those are people, as I mentioned, who are at highest risk for complications from influenza. They also are folks who don't necessarily have as strong an immune response to vaccines, and so the more potent vaccines are reserved for those groups. The recombinant vaccine is one that is, unlike the others, is not grown up in eggs, and you may have heard that people who have egg allergies might not be the best candidates for routine vaccines, but actually the CDC does recommend, unless you have a severe egg allergy, you're fine to get any of the ones above.
Okay.
I might also add that pregnant women should be vaccinated. The antibodies that are produced as a result of these vaccines can travel across the placenta and protect the baby for the first 6 months of life.
wow.
So it's really important for pregnant women to be vaccinated. The nasal spray is actually a live vaccine. It's recommended for people from age 2 to 49 by the FDA, and it's something that doesn't involve getting a needle stuck in your arm. So some people are anxious to have that vaccine instead of one of the injections.
So a commonly asked question, people want to know how many doses are there available, and even more importantly, is that enough?
That's a great question. So there are a number of manufacturers for the various vaccines, and it's estimated that between 163 million and 168 million doses will be distributed this year in the United States. And in fact, so far, as of last week, 119 million of those doses have been distributed. So is that enough? Well, one of the issues is that fewer than 50% of Americans choose to become vaccinated. This is a big problem. Keep in mind that CDC recommends everybody in the United States from the age of 6 months and older be vaccinated for influenza. So I think production doesn't reflect the number of people in the United States, only about half, because so many people don't get vaccinated. But I want to emphasize, we encourage everybody. It is strongly recommended that everybody get vaccinated. Even though there may be what we call a mismatch between the influenza vaccine given this year and the one that ultimately is circulating primarily, there is still evidence that you will prevent millions of hospitalizations and thousands, maybe tens of thousands of deaths if you personally get vaccinated, because you're still reducing your risk of severe disease. Even if you get the flu, it will be milder and you will have less chance to transmit it to people who are vulnerable.
Yeah, and I think that's a big question, especially, Stacy, for people who are on the fence about all of this is, okay, I'll do it. But how effective is it really? And I know we touched a little bit on it earlier. How do you know? So when people say that, okay, I'll go through the trouble, but really how effective is it? Your response is?
Very effective.
Yeah.
Yeah. And I think there's a lot of myths surrounding getting the flu shot, a lot of stigma around having the flu shot. But the fact of the matter, you hear people say, I never get sick, but not only are they protecting themselves, they're protecting those vulnerable populations, children, the elderly, those who, when and if they get the flu, they have more devastating effects.
Okay, and you represent one of those more vulnerable populations. Before we get into protocol and so forth, how did you get involved in the older adult realm?
So I started nursing, and I never thought that I would work with seniors. It wasn't the route that I thought I would take. I got a job opportunity as I was continuing my college education and absolutely fell in love with it. It has been my passion since day one, and so my whole career has been with senior adults. Okay, so for people trying to visualize now, paint a picture of the environment where you work, Stacy. Oh, it's fabulous. So it's a whole culture. I think people think of senior living and, there's the nursing home. It's where you go to die and the whole clinical setting. And it really isn't that way anymore. The quality of life that seniors have in an assisted living or a skilled nursing has changed so much. There are lots of activities going on, interactions. A lot of times seniors can be isolated in their home. So, we offer 3 meals a day, so they have good, healthy meals. And then they have the assistance that they need throughout the day. Yeah, one of those being the flu shot. Yeah. So this time of year is coming. How do you and your team prepare for this particular season? Yeah, so we really want to be proactive rather than being reactive. So we are doing flu clinics for our residents and for our staff. We are offering free flu shots for all of the staff because, again, we want to protect them. We do education, of course, infection control, especially in a community setting when you have that many people in such close quarters, is important. So we're doing extra education around that, looking at housekeeping protocols and how well we are disinfecting, having hand sanitizer readily available for visitors, staff, for residents. Okay, and we would expect that just from a family members or visitor standpoint. So my question is, what can we expect to find in every senior living community right now? Things that you just explained, anything beyond that? And if we don't see it, Stacy, what do we do? I think all of the same things in any senior living community, being prepared for it before and preventing it before you have a flu instance or outbreak, which an outbreak is only considered 2 individuals confirmed with the flu. So in a senior living community. So you say outbreak and it sounds like, you have several residents. Truly, according to the CDC, that's only 2 residents. But we want to prevent even 1 resident being. Okay, so there's so much going on in those communities that you're needing to pay attention to. When you suspect, when an older adult shows those signs and symptoms, 1 or more of those, talk about the protocol in place, especially knowing how contagious this can be. Sure. If we suspect that somebody has the flu, if they're showing any of the symptoms that we talked about before, we're going to isolate that resident so that we are minimizing the chance of exposure to any of the other residents. We want to test them, obviously, and confirm that it is the flu or that it is not. If it is, in fact, confirmed that it's the flu, we want to notify the CDC. We want to notify our other residents and their families, so we might post signs. We would encourage residents to stay in their apartments or stay in their rooms. If there's different neighborhoods in the community, suppose there is a resident in assisted living who has been diagnosed or confirmed that they have the flu, we are going to encourage all of the residents in assisted living to stay in that neighborhood, stay in their rooms, and not go to the other neighborhoods.
Okay, and one of the things I really want to bring up here is visits are so important for older adults. And I know that there will be times when family members maybe suspect somebody's not feeling quite right, but they haven't seen grandma or grandpa in such a long time. Talk about the importance of saying, you know what, not now, right?
Yeah, it is so important. If you have any of the symptoms, to stay away. Of course the visits are important. Make a phone call because it's such a fragile population, and the effects on them can be much more detrimental. So if you have just a sore throat, make the phone call rather than coming in.
Yeah, and I want to talk a little bit in terms of protocol here. There are some residents, especially in those 24/7 environments, that aren't able to use the phone. Maybe they don't have a phone in their room. So if we do get into a time like that, Stacy, where you're really encouraging people to stay away for in the best interest of your residents, staff probably there ready to help with the telephone, ready to bring something down the hall to them. So talk to the family members about that a little bit.
Yeah, we will find a way for communication. We have tablets, they can Skype their family. We have public phones, so portable phones that we can bring to them, disinfect obviously after leaving the room. So there is always a way.
Yeah, they're not putting you out. It would be worse if they came in and then
and we're not
more people
saying
got
that they
sick.
Yeah. And even if we have the flu confirmed in our building, we will discourage visitors at that time. We're not saying that they can't visit. We're just really discouraging it. But we'll offer masks and hand sanitizers, encourage hand washing.
Yeah, Dr. Freifeld, talk about how important, incredibly important that protocol is.
Absolutely. One thing that we haven't mentioned is how the flu is actually spread.
Okay.
So I want to emphasize that influenza is typically spread by small droplets that are put out into the air when somebody coughs or sneezes or even talks or sings. These small liquid droplets can land on various surfaces, and they can also land on the face or nose, mouth, eyes of another person who's in close proximity. And usually a person is contagious, meaning they're putting out these droplets with virus in them from one day before symptoms occur. So they have no symptoms and don't know that they have the flu. They are still contagious until about 3 to 5 days after the onset of symptoms. So you can imagine anybody that you might be next to in the line, in the grocery line, or in class, or on a bus, you could be exposed. And again, that's why it's so important to get that vaccine, to reduce the exposure of other people, to reduce transmission. So because it's spread by droplets, masks are extremely important. And at UNMC, and I'm sure at Brighton Gardens, when a patient or a resident is diagnosed with influenza, anybody who comes into the room must have a mask on, preferably also a gown and gloves, so that you reduce the transmission by touching a surface that might have influenza on it. Extremely contagious virus.
Wow, very, very good points. In just the minute or so we have remaining, final thoughts.
Well, I can't emphasize enough the importance of having a flu vaccine. This has been a disease that's infected humans for eons, and we're so fortunate to live in a time when we have a measure that can prevent or reduce influenza illness. We should use it. Relying on the antiviral drugs can be problematic because of resistance occurring, and it is starting to occur. So the most important thing that we can do for ourselves, for our communities, for our loved ones is be vaccinated every season.
Okay, thank you very much. And we do have a few websites that we want to put up for our viewers in the event that they would have any more questions about today's program. cdc.gov/flu and webmd.com. And I know you wanted to maybe add a little bit about the websites, the WebMD.
Well, I would say that WebMD, even though it says MD there in the title, is a wonderful resource for the general public. They present information in a very understandable and readable fashion, so I would encourage you to go to that site. But the CDC also has a wealth of information that ranges anywhere from information written for the lay public all the way through medical professional level.
Perfect.
So there's quite a lot of information on both of those sites.
And from the two of you today, thank you so much for sharing your time and expertise with us. Best wishes during this season. I want to thank the students for working so hard behind the scenes, of course our viewers for watching. As we close, a look at Standing Bear Lake is seen through the lens of Maria Holloway, a junior here at UNO. We will see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/Consider This. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.
Support for Consider This is provided by
There's a new place for senior care, a place with flexible meal plans and 24-hour room service. A place where seniors get the care they need in the comfort of home. Home Instead Senior Care.